Hi again. This time I'm going to be talking about what you might want to bring to the hospital if you're having jaw surgery. It's not as much as what you might think. And if you're having a surgery similar to mine, which was a bilateral disc repair and repositioning. First of all, you don't need more than an overnight bag or just a small backpack, because the hospital provides pretty much everything for you. But if there's anything you want that you usually take with you, you might want to carry that, like your cell phone, for instance, so your family members can use it. I don't know. But the first thing that you might want to take is, and the most important thing, I think, besides the splint and the Allen wrench that comes with it. In my surgery's case, yours may be a little different. I have my splint right now, but you will wake up with it in your mouth. But anyway, the most important thing to bring, I think, is a notebook and a pen. Now, keep in mind, you will probably be medicated during your stay, which is usually one night, but it might be 2 or 3. It depends on how your pain is. There's a notebook and a pen that clicks. You don't have to worry about a cap, and a pen with a clip, so you can clip it to the notebook. This is really important. And also, you might want to bring a marker board. But the thing about a marker board is you have to keep erasing, and you have no record of what you said. What I like to do is, what I think is good is you can look back on what you said and how far you've come, and you can write down questions that, as you think of them, to ask your doctor whenever he visits. Also, in case the hospital doesn't have soft tissues, you might want to bring your favorite kind of tissues in a travel pack. And you need to bring some form of entertainment or connection with the outside world, especially if you're my age, and you use YouTube and things of that nature. You would want to bring, I brought my iPad with me, but actually, I tell you what, my family ended up using it more than me to entertain themselves while I slept most of the time. So it serves quite a few purposes. Also, another important thing, that your doctor will be very proud of you, because when you have jaw surgery, your doctor doesn't want you, whenever you lay down, that you'll only be able to lay at 45 degrees, probably. You have to be propped up. So, if you have a regular pillow, you can turn your head like this, but your doctor will be very proud of you if you bring a travel pillow. This way, the lordosis, the curve in your cervical spine, will be supported, which is good for posture, and you can't turn your head that much to damage where your newly placed discs are. And also, as far as eating, they will probably bring you mashed potatoes or pudding, which was my favorite. They had really good banana pudding and vanilla pudding and everything. But you might want to bring your own things if there's something you really like Ensure, just to make sure that they have your favorite flavor. You might want to bring your own thing like that. But as far as eating, they might just give you a spoon, or they might give you a fork that's too big. So I would carry a plastic bag full of disposable plastic forks and baby spoons. probably won't need the baby spoon because you can eat just about anything with a fork except for soup, which you can drink. So you really never need spoons. I've found that. And the thing about a spoon is it has depth. So it's really, I don't know, I've always found a spoon to be painful to eat with since I've had jaw problems. Also, another one of my favorite things, anyway, is you want to bring chapstick. Believe me, your mouth will be dry when you wake up, and your lips will be dry too, and I don't know, I use chapstick anyway. Also, if possible, you want to bring a friend or family member, someone who's got your back, because you aren't going to feel like doing anything. So if you need something, you're going to have to write it to them, or signal to them some way. If you can come up with some sort of, if you know sign language, that's great, but if you can come up with some sort of, I don't know, signage, that would be good before you go to the surgery. But also, when you're writing, you want to have a code too. Like, for instance, the other person couldn't talk until I put an asterisk at the end of what I wanted to write, because I found that people would interrupt me as I was writing because it would take me so long. So you want to have that figured out before you go. I didn't, and it was sort of a problem. And I don't remember what I was saying. But anyway, so that's important. And also, they will give you socks. They give you a gown. They also put on these massage things on your shin, it wraps around your shin or your calf, and it blows up. One will blow up and the other one will blow up, and it simulates walking. It actually really feels like a massage, so that's nice. They give you everything, you're paying for it, you might as well use that. Don't worry about bringing your own clothes except for clothes to go home. And probably bring tennis shoes so that you don't, slip with any sort of other shoes on your way out. Or, I don't know. And let's see, your surgeon probably won't allow you to touch your face because of infection. So try to remember not to touch your face unless you have on sterile gloves. I didn't do that. I didn't get an infection. If you do it, that's not to say you would get an infection, but I just tried to do that. That's about all I have to say as far as what to take. I mean, just, you don't really need much at all. They have it all. Just make sure you have someone there. The main thing is to have someone there to get stuff for you. If you need ginger ale, they can get it. If you need more morphine, they can call the nurse to get it, and you don't have to worry about that. You can just try to rest and stay asleep. But anyway, check out my blog for more information. It is tmjointventure.blogspot.com, and it will have these videos as well as more information and pictures. So that'd be nice if you visited that. Okay, bye, and thank you for watching. And I should be posting another video shortly on my next follow-up appointment.